Hi, my name is Dr. Ron Mariotti. I'm a naturopathic physician in Seattle, Washington. As you can see, we're not in Seattle right now. We're just about 2 to 3 hours outside of Seattle in the central western Cascades. When I'm not teaching or I'm not in my clinic, I like to be out in the mountains with my partner backpacking and enjoying some of the most amazing backcountry that there probably is in the world. I've been practicing as a naturopathic physician since 2004, and I've been teaching visceral manipulation for the Barral Institute and Jean-Pierre Barral since 2007. In my practice, mostly what I do in my practice is visceral manipulation, although I also see patients for regular naturopathic consults and primary care visits. But mostly I do visceral manipulation. Visceral manipulation is a gentle manual therapy that helps to normalize visceral mobility and motility. Jean-Pierre says that when an organ is for an organ to be in good function, it must have physiologic motion. In other words, for an organ to function, it needs to be able to move. When there are situations where maybe a post-surgical situation where there's some scar tissue around the organ, where the organ is not moving as well anymore, then the organ is no longer able to function as well. So if you're wondering if visceral manipulation is something you'd like to try, this might be useful for you. It's wonderful and very effective for all sorts of gastrointestinal issues, urogenital issues, and thoracic issues. It also has effects on the joints, as Jean-Pierre has found that every organ has a correspondence to each joint. And also, the brain uses the organs as a means to discharge emotional energy. So it also can be very useful in emotional issues where the emotions are more stuck in the organs. So if you'd like to set up an appointment with me, go ahead and contact my office. Check out my website a little bit more detail. There's a wonderful page on testimonials where you can read stories from different patients and their experiences with visceral manipulation. And you can also check out my patients' forms and information page, read my new patient letter, and if you want to set up an appointment, just give me a call and we can do that for you. I look forward to seeing you maybe in the future. Take care, and I'm going to get out and do a little bit more backpacking. Bye-bye.